Hello and welcome to the webinar about medical information services and programs from Southeastern. I'm Sarah Holsted, Hospital Library Services Program Manager.
And I'm Tessa, Killian, Executive Director of Southeastern. I'm so pleased to be here with you today, Sarah.
And you too, Tessa.
This is the fourth in a series of short webinars that give an overview of the services and programs that Southeastern provides for its members. Our goal is to make sure that our members know about the resources they have access to and who they can contact with questions or feedback. This slide lists all the webinars in the series, which are on the third Tuesday of every month at 1. You can register for upcoming sessions from the link on our webpage, which is listed on this slide. All the webinars are being recorded and posted to our YouTube channel. They are also available from this same link. We start each webinar by showing where Southeastern fits into the library landscape. Southeastern New York Library Resources Council, or Southeastern, is a nonprofit member organization serving libraries and cultural organizations in the Hudson Valley since 1967. Southeastern is one of 9 library resource councils in New York. The councils make up the Empire State Library Network, ESLN. Southeastern serves libraries in 8 Hudson Valley counties shaded on the map. We provide services to libraries of all types: public, academic, special, hospital, and school. Additionally, we serve museums, archives, and historical societies. And we work very closely with the Mid-Hudson Library System, the Ramapo-Catskill Library System, and 5 BOCES school library systems on many of our services.
There are many ways to engage with Southeastern services, programs, and staff. Sign up for the monthly newsletter, attend a special interest group meeting to exchange ideas with colleagues in the region, or binge all the webinars from this series and get caught up on our programs. After that, dig in a little deeper on the Southeastern website, www.senylrc.org, or contact Tessa or a staff member. For this webinar, we'll talk about the Southeastern services and programs related to medical information. I'll turn it back to Tessa to give some backstory about these programs.
We are fortunate in New York to have 2 programs that support access to medical information. One is the Medical Information Services Program, or MISP, and the other is the Hospital Library Services Program, otherwise known as HLSP. The state legislature enacted these 2 programs in the early 1980s, funded with New York state aid to libraries. As a resource council, Southeastern has managed these programs since their inception. In the 40 years since they started, the primary purpose for both programs has been the same, and the outcomes are just as relevant. The purpose of MISP is to improve access to medical and clinical information for health professionals and to facilitate access to consumer health information to benefit all residents of New York. The purpose of HLSP is to support the resources and services of the medical libraries in the region to meet the information needs of medical staff so that they can provide the best quality patient care. The end goal for both programs is the same: for New Yorkers to have healthier lives by getting accurate medical information. So the key word for today for libraries is accurate. Libraries can play a crucial role in facilitating access to accurate health information, and I know that the MISP program does this.
Definitely it does. The Medical Information Services Program ensures that all New Yorkers have free access to accurate health information because Southeastern uses MISP program funds to subsidize interlibrary loan costs for resources on medical or consumer health topics. In the resource sharing webinar that's part of this series, Kelsey and I talked about the ILL details for the MISP program, so be sure to check that out. Here's how MISP works. If a Southeastern member, library, or system has a patron who needs a medical or health-related resource that your library doesn't have, you can send an ILL request to Southeastern using an online form. Southeastern staff will manage the request and process the payment with MISP funds if the medical lending library charges a fee.
It's fantastic how libraries are willing to help one another by lending articles or books, but sometimes there's a charge to borrow an article, and the cost for this can be covered by MISP, which saves the library and the patron money. But what if the patron wants a specific health information source right away? Is there a way to facilitate that request?
Yeah, there totally is. There's a couple of ways. One way to speed up the ILL process is to have complete citation information to put into the ILL form. And a great resource for verifying medical citations, specifically articles, is PubMed. This is a database of 35 million citations from the biomedical literature. It's maintained by the National Library of Medicine in the US, but its scope is international. It is free for patrons and library staff to use, and some of the citations include links to full-text content. In fact, you can limit search results to free full text. So library staff and patrons should check to see if an article they want is available on PubMed. I love PubMed.
I agree. PubMed is a fantastic resource, but I want to highlight something you mentioned earlier. Southeastern is a bridge between medical and non-medical interlibrary loan and payment systems. The MISP program helps get both medical and consumer health information to New Yorkers in our region. The second program that Southeastern manages, the Hospital Library Services Program, also supports providing medical information and impacts communities and residents in our region.
Right. Southeastern manages and distributes funds from the HLSP program to purchase medical resources, such as journals, books, and databases for hospital libraries. It's great because medical information in those resources can be used to fill ILL requests from the MISP program. But I need to back up. People are always surprised when they learn that there are libraries and hospitals and hospital librarians. Hospital libraries and librarians serve a very specialized audience: doctors, nurses, allied health professionals, residents, and hospital administrators. And the resources they use are specialized too. They're written by and for medical professionals using very technical language. Nurses and doctors use these resources for research, for professional development, and for direct patient care. Medical information resources must be accurate. Some of the words used to describe them are peer-reviewed or evidence-based. And so when doctors and nurses need this medical information, time is of the essence. It's critical to have an information professional, the hospital librarian, who can meet the information needs of medical staff so they can provide the best patient care possible. Hospital libraries usually have a staff of one. Southeastern's HLSP program supports the hospital librarians working in our region through professional development opportunities and by managing the consortial purchase of medical resources for hospital libraries.
The HLSP program is great, and it ensures the viability of medical libraries in the Hudson Valley. It's reassuring to see the state supporting hospitals and libraries through this funding. In addition to the state-funded programs we just discussed, at the federal level, the National Network of Library of Medicine, or NNLM, also supports getting accurate medical information to the public, where libraries are crucial to these efforts. The NNLM is part of the National Institutes of Health and comprises 7 regional medical libraries. New York is in Region 7. This is important to remember because the specific regions provide grant programs and professional development opportunities. Their goal is to improve individuals' access to information to enable them to make informed decisions about their health.
NNLM has several ways to engage libraries, especially public libraries, to help them improve access to health information. The first is through grant funding. Region 7 has 2 funding tracks: the Technology Improvement Award, up to $10,000, and the Health Information Outreach Award, up to $20,000. The RFPs are announced in the fall, and proposals are due in December. Writing proposals can be daunting, but Region 7 has a lot of documentation, and Southeastern has successfully applied for these awards and can offer some guidance. NNLM also provides free professional development opportunities for library staff. The course catalog is online, and it has classes aimed at health information professionals, like hospital librarians, and librarians who engage with patrons seeking health information. Some of the classes are about providing consumer or mental health information at your library, or building a consumer health collection. There are also online courses for library staff to advance their careers by earning specializations in health information. NNLM also has programming materials. Libraries can sign up to host a traveling exhibition, and Region 7 offers a graphic medicine book club kit on several topics, such as mental health, cancer, aging, and LGBTQ.
You know, everything we've been sharing today is really related to digital health literacy, which is defined by the World Health Organization as the ability to seek, find, understand, and appraise health information from electronic sources and apply the knowledge gained to address or solve a health problem. So Sarah, can you tell us a little bit about how NNLM helps all of us with digital health literacy?
Yeah, so a great foundation for digital health literacy is Medline Plus at medlineplus.gov. This is a free online health information resource from the National Library of Medicine that all libraries can share with patrons who are seeking accurate health information. Medline Plus is organized around health topics, written in easy to understand words, and has resources in multiple languages. It has a section on drugs and supplements, including herbal supplements, and a medical encyclopedia. I tell my family and friends to skip their favorite search engine and bookmark Medline Plus. So we've covered a lot of content in this webinar, and the links on this slide will help you explore in more detail. If you have any questions, please don't hesitate to get in touch with me or with Tessa.
So thank you for being here today to learn about these important services and sources of accurate medical information. So thank you, Sarah.
Thanks, Tessa. Now go out and bookmark Medline Plus.
Oh yeah, we use it. I use it. I start there all the time and recommend the same. Family and friends, everybody, just go there.
Just go there.